The Voices of Acromegaly, a 360-degree look at the condition. Part 2. Managing Acromegaly, a day in the life. It's challenging to manage acromegaly. Patients should work with their physicians to regularly monitor and control their GH and IGF-1 levels to help reduce the potential health complications of acromegaly, such as heart disease, hypertension, or diabetes. There are also often psychosocial effects associated with this rare and life-threatening condition. Listen to the following people describe the day-to-day struggles of living with acromegaly, the challenges faced, and the adjustments they've had to make in order to cope with this condition.
So there's a lot of stress around the diagnosis to start with, the length of time it takes to get the diagnosis. And then you're faced with possibly surgery, maybe radiotherapy. That's very frightening. What does that mean?
Going into the surgery, I was terrified. I thought that I was going to die. I honestly, went around and hugged everybody that I knew and said it was nice knowing you.
He had a very good education. He was an engineer, from the best engineering school in Russia. But he couldn't do regular work because he had all these headaches and also now I understand that there are psychological symptoms which don't let him feel like others.
When I was in sales job, actually moving around from one place to other for I needed to do a couple of places every day, and I think that was the most difficult part for me. Because after they changed my position to a new department, I didn't have to, I don't have to move around anymore. I just do the office work and I'm doing well now.
So after the surgery, 4 or 5 days of feeling pretty headachy and crummy. But after about a week, I felt like a new person. I felt like I could see clearer. I could smell better, I could actually sense different smells better, food smell better. I just had more energy.
The problem is that if you don't talk about this, if you don't go to the doctor, if you don't get treated, then you just get worse and worse.
So I go to my endocrinologist every 6 months to get my blood work checked, all of my hormones and various other blood work. For a number of years after my surgery, it was suspected that the tumour was coming back because my hormones were still a little out of whack, but it has managed to level out and become normal again.
I do know that it's important to monitor my hormone level on a monthly basis because my doctor told me about the complication of acromegaly, and you can get hypertension or diabetes and so many different things. And I do know that it's important to control my acromegaly to avoid those complications so that my quality of life get maintained.
Dealing with acromegaly can be a difficult experience. Patients should discuss their signs and symptoms with their physician on a monthly basis to ensure their current therapy is meeting their needs. Please visit acromegalyinfo.com in the U.S. or aboutacromegaly.com outside of the U.S. to learn more about the disease and acquire supportive resources and materials.